And welcome everybody to today's webinar. So today we're going to be talking about understanding your diabetes type. But before we begin, I want to ask you a few questions and see how you answer them. So the first question is, I have diabetes and there's nothing I can do to better manage my blood glucose. Do you think that's true or false? All right, so if you answered false, that is actually correct. You want to be able to try and manage your diabetes by doing some lifestyle interventions like eating healthier, exercising, managing your stress in different ways. All of that can definitely help you to better manage your blood glucose. Second question is, all types of diabetes are the same. Is that true or false? So that's actually false, and that's why you're here tuned into today, because we want to talk about the different types of diabetes that there are and explain them a little bit further in detail. So we'll be talking about that in the next couple of slides. Diabetes is definitely becoming more and more prevalent every year. We currently have 1 in 11 adults that have diabetes. So it's about 415 million adults that currently have diabetes in the US. That is a huge amount. And with diabetes becoming more and more unmanaged, that's eventually leading to death. So we have about 70,000 deaths annually in the US every year that comes about from diabetes. So when diabetes isn't managed, it could eventually lead to death. So it is really important that when someone is newly diagnosed, that they understand the gravity of it, not to scare people, but to just let them know that it is important to start managing it rather than just saying, oh, well, I have diabetes now, there's really nothing I can do about it. When you do start to begin to manage your blood glucose, lots of awesome things can happen. First, you start to save your eyes. So there would be a 76% reduction in diabetic retinopathy. Basically, that means that your eyes begin to improve. So if you've ever had cloudy vision or you had to get new glasses, it could have been because you had a lot of blood sugar, or your blood sugars were very high, and that affected your eyes. So as soon as you begin to manage your blood glucose, that begins to decrease. You also have improved kidneys, so that you won't eventually have to go on dialysis and have your blood be filtrated through a machine. So when you do manage your blood glucose, your kidneys significantly improve and they don't end up getting damaged. You also have reduced nerve damage so that you don't have issues with your hands or feet. What happens when your nerves get damaged is that you could get a cut and not even feel it, so that cut would eventually become infected and you'd have to go to the doctor and get antibiotics and things like that. So that's why it's important as a diabetic to make sure that you do get routine checks on your feet and hands, especially because you may not even feel those cuts. And then also you have a reduction in cardiovascular risk. So it definitely can improve your lifespan if you do manage your blood glucose today and you take charge of that. So what exactly is diabetes? A lot of people ask, I have diabetes now, but I really don't know what that means, or my doctor didn't really fully explain it to me. So I'll just go over it very briefly. Basically what it is when you eat food, whether it's a sandwich, a salad, a burrito, whatever food that you're ingesting, that food eventually turns into glucose or sugar. And then that sugar is taken up into the body cells and used for energy. So what diabetes is a disorder that makes it difficult or even impossible for the body cells to use glucose for energy. So in the next couple of slides, I'm actually going to show you what that looks like in the body when the pancreas works with the cells to be able to take up glucose. So over time with diabetes, if your cells are not taking in that glucose and using it for energy, it starts to build up in your blood. So I put a little picture down at the bottom where you will see how blood can build up over time. So you have normal levels in the middle where that's a normal amount of blood sugar that's left in the blood. And then you have hyperglycemia, which is high blood sugar when you have a lot of sugar in the blood. And that can eventually lead to issues with your eyes and kidneys and eventually possibly death if it goes unmanaged for a long period of time. And then you have hypoglycemia, which is not enough sugar in the blood so that you feel lightheaded or irritable. It's like basically when you're hangry and you just need to get some food in your system to be able to get that blood sugar back up. So with diagnosing diabetes, it is important to get your blood levels checked. So you want to make sure that you go to the doctor, get evaluated, get your yearly physicals, because it could be a matter of only, a couple of months that you start to develop pre-diabetes. So that's why it is so important that you go to the doctor and get your checkups to become preventative rather than reactive. A lot of people tend to wait to go to the doctor when they feel sick, but it is important to get your values checked ahead of time. So on the left-hand side, you can see on this page that there are two different ways that you can check for diabetes. There's actually more tests that can be done, but these are just two of the main ones. So the first one is by checking your fasting blood glucose. And this can be done at home with a glucometer. So some diabetics do this daily, maybe even 4 times a day, where they use a glucometer and a strip to test their blood and see what the value is. So if it's below 100, that's considered normal blood glucose. If it's anywhere from 100 to 126, when you get that little reading on your glucometer, that's pre-diabetic. And then if it's above 126, that's in the diabetes range. So that's an at-home test. You could also get that done at the doctor or by a healthcare professional, but that's something that you can do easily. It just gives you kind of a snapshot or an instantaneous shot of what's going on in your body at this very moment. A different test that's done by the doctor or somebody who takes your blood when you go to the doctor is your A1C value. So this one is really important because this is a longer term shot. It's not just a one-time shot where you see it right here and right now, but it shows you over a 3-month period what your red blood cells look like. So if your A1C, if they say your A1C is below 5.7, that's considered normal. Now if your doctor comes back and says your A1C is between 5.7 or 6.5, let's say it's 6%, then that's pre-diabetic. So if you've heard A1C a lot, when you go to the doctor, your A1C is this, your A1C is that, they're really talking about the value that tells you how your diabetes is doing. Some diabetics can have their percentage value as high as 11 or 12% when it's unmanaged. That's when they really want to see a dietitian, make sure that they come in and get evaluated. They can go over some tips and techniques on how to eat better and exercise to get that value to come down. So we really want to bring that value down as low as possible. So if you're in the 6.5% range, then you're considered diabetic. So as I mentioned, A1C of 5.7 to 6.4 is considered pre-diabetic. More and more individuals, as I mentioned earlier, are getting pre-diabetes, which eventually turns into diabetes when it's unmanaged. So there's a lot of pre-diabetics, and you may have been somebody who had pre-diabetes at one point who don't even know that they have it. So that's why I encourage people to definitely go to the doctor and get their values checked, make sure that they know what they are so that they can continue to prevent diabetes. If you do have prediabetes, you can definitely meet with a dietitian or just start to better manage your diet and your exercise and your lifestyle, sleeping more, managing your stress to be able to reverse that prediabetes and get it back into a normal range. So if prediabetes isn't managed, eventually that will turn into diabetes. There are 2 lifestyle-related types of diabetes that can occur. There's type 2 and then gestational diabetes. Type 1 is a little bit different. This actually manifests when you're a child or at an early age. It can even happen in your 20s, but it's an autoimmune disorder where the pancreas isn't able to produce insulin. And we'll show you on the next slide what is happening in the body when that occurs. With type 2 diabetes, over time, and with gestational diabetes, with lifestyle factors, with not exercising or eating right, eating large portions, gaining weight, things like that, you become insulin resistant. So even though your body is making insulin, your cells are not actually able to take in that insulin so that the glucose can be used for energy. So this usually happens with adults, and even now it's happening younger and younger with younger children because of their unhealthy lifestyle habits as well. So just keep in mind what these different types are. If your A1C is above 6.5, again, you'd be considered diabetic. So this is a great picture to show you how exactly insulin is used in your body to be able to take up glucose. So the first row, you'll see a healthy pancreas and a healthy cell. So when the healthy pancreas creates insulin, it excretes it out and it travels to your cells to give them energy so that you can move throughout the day, you have energy to go to the gym and do the different tasks that you have to do at work. Well, that's what a healthy body does. You also see on the cell that an insulin receptor is attached to the cell. What happens is the insulin, that little blue ball, acts as the key to open the insulin receptor, just like you would, to your house, to open the door and go in, to allow the glucose to then be used by that cell. With type 1 diabetics, they actually don't produce insulin. So they have to use an insulin pump or they have to take insulin injections in order to have that key to open that door or open that insulin receptor. So again, keep that in mind that they don't produce insulin. So if you're type 1 diabetic, your body is not producing that insulin or that key. With type 2 diabetes, your body still produces insulin. It's just that the key is a little bit bent, so it's not able to open that insulin receptor like it used to, and that glucose is not being able to be taken up by that cell to be used for energy. So those are primary differences between type 1, type 2, and gestational diabetes. So you may be asking yourself, well, now I'm diabetic and I'm not sure if I need to take insulin or medication, or what's the deal with all of that? So it really depends on the severity and the type of diabetes that you have on whether or not you're going to have to take insulin or medication. For type 1 diabetics, typically they will always have to take insulin either from an injection, or they'll have to wear a permanent insulin pump that's used whenever they eat. They give themselves some insulin, and that way their cells open up and take in that glucose that came from the food. They may also need to take medication depending on their type. For type 2 diabetics, again, it really depends on the severity and also, how far along they are, whether or not their A1C is very high. So if their A1C is very high or yours is, your doctor may want to put you on medication to control your weight, to help improve your insulin resistance so that you can start taking in that blood sugar that's in your cell or that's in your blood. And with gestational, again, it really depends on the stage that the pregnant woman is at. So if you're gestational, you may or may not need to take insulin or medication. Again, that's up to the discretion of the doctor. But again, you can always talk to your doctor about your different options. And hopefully they'll always send you to a dietitian to be able to talk to them about diet as a great way to bring down your numbers, as well as exercise. So it is important that when you are diagnosed with diabetes that you really start to think about how you're going to change your lifestyle for the better. Losing weight is a great way to start to bring down your A1C number to a better number. It's also a great way to improve your insulin resistance. So even about a 5 to 10 pound weight loss can be incredible in helping with your numbers. So getting active, even if you're not currently active, just start by walking 10 minutes a day. And then the next week you can start to increase that number to 15. Just start doing things a little bit different, but all of those things in combination can definitely help to improve your diabetes. So here are just some quick tips that I'm going to give you so that you can start managing your diabetes a little bit better. So here are some food hacks. What you want to do is make sure that you have a week's worth of snacks prepared ahead of time, and that you have them, if you can, with carb labels, especially for type 1 diabetics. They need to know how many carbs they're taking in order to match it with their insulin. So this will help with your timing of meals so that you don't skip meals and your blood sugar drops, or you don't have a sugar spike because you got so hungry and you ate whatever you saw in sight. So preparing a week's worth of snacks ahead of time on a Sunday when you have some free time is a great thing to do. Also making sure you organize your pantry and fridge, having everything that's healthy to the front. You can have a really cool bowl that you have as a centerpiece with fruit in it or vegetables, to keep in mind that those are the things that you want to be eating more of. You can also use an app to log your food and carbs eaten. So one that I like is My Sugar app. You can actually keep track of all the foods that you've eaten. You can log if you are checking your blood glucose, you can log those numbers in there, and then you can kind of see what's affecting your blood sugars or which foods are affecting them more. And then you can also keep glucose tabs in your car, or even just a little piece of candy or some juice, that if you do have hypoglycemia one day, you can just have a little bit of it, and then you wait 15 minutes to see if your blood sugars come back up. Here are some hacks that you can also use, such as taking hand cream with you. Because of diabetes, this could produce dry skin or cracks and things like that. So you really want to moisturize and make sure that your skin is healthy. And you also would like to, or you should carry some hand wipes with you, so that this will improve the accuracy of you checking your blood glucose. So again, you may or may not need to check your blood glucose depending on what your doctor has suggested. But in order to get a good reading, you want to be able to clean your finger with some alcohol to get any sugar that might have been left from a food. You also should carry your diabetic and medical info with you in case you do have some sort of issue with hypoglycemia and you pass out. If you have that information on hand, someone can tell that you're in a diabetic coma and will know what to do based on the information provided. So that will come really in handy with individuals who have type 1 who tend to have more of those episodes. And when you're traveling, put all your diabetic supplies in one bag with a medical letter as well. So if you're traveling and you need to take something on board with you, like needles and things like that, it's always good to have a piece of paper from your doctor saying that you're diabetic and that you should be able to carry these things with you. And so these are some tips that are really great for type 1 diabetics. If you are taking your insulin or checking your blood sugar, or anybody who's doing this, a great thing to do is have a tactical box or a tackle box where you can put in your diabetic supplies like your insulin, your syringes, and have it well organized so you know all the supplies that you have. If you are using a pump, you can always use a hair tie in case the little clip breaks. You can use that to wrap around your belt loop and keep that handy so you don't have to buy a new pump. You can keep a list on your fridge of things that you need. So as you start to use your insulin and your syringes and things like that, or even your glucose strips, you can write down, if you need to buy more, just like you would a grocery list. And then on-the-go shots would be great in a toothbrush plastic container, so you keep yourself safe, you're not poking yourself with your needles. And this last slide is for gestational diabetes. So making sure that you monitor your blood glucose daily is important, especially when you're pregnant. You don't want to have any sort of complications during pregnancy due to gestational diabetes. Also making sure that you go to your doctor, get your regular checkups, go to your dietitian and talk to them about how to eat better. And then also, this will be really helpful because once you do deliver, definitely your gestational diabetes could go away, but it could come back as diabetes later on in life if you don't start to manage your numbers today. So it really is important to start to change your lifestyle habits for the better. So in conclusion, you want to make sure that you do start to think about managing your diabetes better, what you can do today to make a better impact in your life. So making one small healthy change a day is important, or even just every week. I don't want you to overwhelm yourself with all the new things that you have to learn and do. Just make sure that you take baby steps because then you'll have longer lasting impact on your life. Getting your friends and family involved is also really important. They should know what diabetes is, so if you need to take them to classes with you so they can understand what it is and how to better help you, I think that's awesome. We have some great classes here that we offer at Health Education Beaver Medical Group in Redlands, where you sit with a group of people and talk about the different things there are to learn about diabetes with medication, eating, exercise, all those great things. And that's a great class to participate in if you're a new diabetic. And then if you want, you can subscribe to things like Diabetes Forecast to get more information on healthful eating and recipes, and just the new information that's coming out about diabetes. So these